Hey everybody, it's Jake Tapper from CNN State of the Union and factcheck.org, and this week we're going to take a look at comments made by Dr. Tom Price. He is the Secretary of the Department of Health and Human Services. He spoke with NBC on March 12th about the health care plan that the House Republican leadership and the Trump administration is pushing. Take a listen.
I firmly believe that nobody will be worse off financially in the process that we're going through, understanding that they'll have choices, that they can select the kind of coverage that they want for themselves and for their family, not that government forces them to buy. So there's cost that needs to come down, and we believe we're going to be able to do that through this system. There's coverage that's going to go up.
So Dr. Price said that he firmly believes nobody will be worse off financially, and obviously we can't fact check what he believes, but in terms of whether or not it's true that nobody will be worse off financially, that's not true. There are going to be winners and losers in this Republican health care bill, just as there were winners and losers in Obamacare. Let's start off with who will do better under this Republican plan as it is drafted right now. 1, young Americans. They could get some cheaper plans. 2, healthy people. They'll have the option of buying less expensive catastrophic plans, which have much lower monthly premiums theoretically and much higher deductibles. Also, of course, wealthy Americans and insurance companies will get big tax cuts. But obviously there are going to be losers as well. According to the Nonpartisan Congressional Budget Office, in 10 years, by 2026, there will be 24 million more Americans who are uninsured under this Republican plan than there otherwise would have been. This includes, according to CBO, 14 million low-income Americans who would have benefited from Medicaid by 2026, plus an additional 2 million Americans who will no longer get health insurance on the individual market. Some Americans will choose not to have insurance, but others will find themselves no longer able to afford health insurance. The CBO also expects the number of people with employer-based insurance to drop by 7 million on net, partly because fewer employees would take up the offer of health insurance without an individual mandate, and partly because, quote, over time, fewer employers would offer health insurance to their workers. Another group that could lose out under this plan, older Americans, those between 50 and 64. That's because the new Republican plan gets rid of the Obamacare mandates, and one of the Obamacare mandates is that insurance companies cannot charge older Americans any more than 3 times more than they charge younger Americans, but that cap will be disposed of. Take a look at what the CBO says about the Republican proposal. Quote, under this legislation, premiums for older people could be 5 times larger than those for younger people in many states, but the size of the tax credits for older people would only be twice the size of the credits for younger people. This is one of the reasons why the AARP came out against the Republicans' plan. The bill, according to CBO, will also adversely impact people in areas with high insurance costs. That's because the Republican plan's tax credit structure will no longer take into account the variation in insurance costs based on geography. Here's the bottom line. The Republican health care plan being debated right now will have some winners and some losers, just like every other healthcare plan. So for anyone to promise to you that no one will be worse off financially because of it, that's just not true. A reminder to all you politicians out there, you're perfectly entitled to your own opinions, not to your own facts. I'm Jake Tapper for CNN State of the Union and factcheck.org.